Introduction. In the modern era, smoking has long been associated with severe health risks, leading to the rise of alternatives such as vaping. Marketed as a safer option, vaping has quickly gained popularity, particularly among younger generations. But how much do we really know about its long-term effects? Is it truly a safer alternative to smoking, or are we witnessing the birth of a new health crisis? A deep dive into the history of smoking and vaping. History of smoking dates back thousands of years. Indigenous cultures in the Americas used tobacco for religious, medicinal, and social purposes long before European explorers arrived. When Christopher Columbus and his crew encountered tobacco in the late 15th century, they brought it back to Europe, where it quickly became popular. By the 16th and 17th centuries, tobacco was being cultivated and traded globally, fueling an emerging industry that would eventually dominate economies and societies. By the 19th century, technological advancements led to the mass production of cigarettes, making them more accessible and affordable. In the early 20th century, smoking was glamorized through advertising, movies, and celebrity endorsements. However, the first major health concerns arose in the 1950s and 1960s, as studies linked smoking to lung cancer, heart disease, and other fatal conditions. Public health campaigns and government regulations followed, leading to smoking bans in public places and increased taxation on tobacco products. In response to growing awareness of smoking-related diseases, e-cigarettes emerged as a purportedly safer alternative. The first modern e-cigarette was developed in 2003 by Chinese pharmacist Han Lik, who sought a less harmful alternative after his father died from smoking-related illness. By the late 2000s, vaping products had entered Western markets, rapidly gaining traction, particularly among former smokers and younger demographics. Today, the vaping industry is a multi-billion-dollar business, yet controversy continues over its health effects and its appeal to non-smokers, particularly teenagers. Scientific findings, comparing the risks. Decades of research have firmly established the dangers of smoking. According to the World Health Organization, WHO, smoking is responsible for over 8 million deaths annually, contributing to lung cancer, heart disease, and respiratory illnesses. Secondhand smoke also poses a significant risk, leading to thousands of additional deaths each year. Vaping, on the other hand, is a relatively new phenomenon, meaning long-term studies are limited. Some research suggests that vaping reduces exposure to certain harmful chemicals found in cigarettes, yet concerns remain over the presence of toxic compounds such as formaldehyde and acrolein. A report from the National Academies of Sciences, Engineering, and Medicine concluded that while e-cigarettes are less harmful than traditional cigarettes, they are not without risks. In recent years, cases of EVALI, e-cigarette or vaping product use-associated lung injury, have emerged, causing hospitalizations and deaths. While many of these cases were linked to vitamin E acetate found in illicit THC vape cartridges, they raised concerns about the potential dangers of inhaling vaporized substances over time. The role of nicotine. Nicotine is the common denominator in both cigarettes and vapes. It is highly addictive and impacts brain development in young users. Studies show that nicotine can alter cognitive function, increase heart rate, and elevate blood pressure. In adolescence, nicotine exposure can lead to long-term changes in brain chemistry, increasing susceptibility to addiction later in life. While vaping products often contain lower levels of harmful chemicals than cigarettes, they still deliver nicotine, keeping users hooked. A study published in the New England Journal of Medicine found that vaping is nearly twice as effective as nicotine replacement therapy in helping smokers quit, yet the risk of long-term dependency remains. Many former smokers who transition to vaping find themselves unable to stop using nicotine altogether. The tobacco and vaping industry. Although vaping was initially positioned as a tool for harm reduction, the industry has been criticized for its aggressive marketing tactics, particularly targeting young people. Several major vaping companies are owned by Big Tobacco, raising questions about their true intentions. Flavored e-cigarettes, sleek designs and social media promotions have contributed to a surge in teen vaping, leading to increased regulatory scrutiny worldwide. The U.S. Food and Drug Administration, FDA, has taken steps to limit access to flavored vape products, but enforcement remains a challenge. In some regions, flavored vapes have been banned outright due to concerns over youth addiction. Meanwhile, tobacco companies continue to market new nicotine products, including heated tobacco devices, further blurring the lines between traditional smoking and vaping. Environmental impact beyond personal health. Both smoking and vaping have environmental consequences. Cigarette butts are the most littered item globally, contributing to pollution and harming wildlife. With trillions of cigarette filters discarded each year, the impact on ecosystems is devastating. Meanwhile, disposable vape pens and e-cigarette cartridges generate electronic waste, adding to the growing problem of plastic pollution. Lithium-ion batteries, commonly found in vaping devices, pose additional risks when not properly recycled. Unlike cigarette butts, which are biodegradable over time, many vape products contain non-recyclable components, exacerbating the issue of electronic waste. The social and cultural perception of smoking and vaping. Societal attitudes towards smoking have shifted dramatically over the past few decades. What was once seen as a fashionable habit is now widely recognized as a major health hazard. Smoking bans in public places, heavy taxation, and anti-smoking campaigns have contributed to declining smoking rates worldwide. Vaping, however, occupies a more ambiguous space. While some view it as a harm reduction tool, others see it as a gateway to nicotine addiction. The rise of vape culture, particularly among young people, has fueled debates about whether vaping should be treated with the same level of regulation and stigma as smoking. Conclusion: the debate over vaping versus smoking is complex, with evidence suggesting that while vaping may be less harmful than traditional cigarettes, it is far from risk-free. The lack of long-term studies leaves many questions unanswered. As research continues to evolve, one thing remains clear: both smoking and vaping carry significant health implications, and the best option for long-term health is to avoid nicotine products altogether. While public health organizations continue to push for stricter regulations, individuals must weigh the risks for themselves. The question remains: is vaping truly a step forward, or just another chapter in the ongoing nicotine epidemic?